had an interview with a man named Eric Goldstein, who created a one-man show on YouTube called Here We Go. And for context, in early 2020, Eric Goldstein saw his doctor about a routine vision problem and walked away with a diagnosis that would change his life when he was diagnosed with glioblastoma, a brain tumor. And we're joined by one of his doctors, Dr. Tobias Walbert. He is from the neuro-oncology department at Henry Ford Health System, and he is a brain tumor specialist. Joining us now on the megacast, Dr. Walbert, thanks for being with us today.
My pleasure. Hello.
Thank you for being with us. We appreciate it. So tell us a little bit about glioblastoma and what makes it such a challenging form of cancer for doctors to treat.
Yeah, so glioblastoma is the most common brain tumor. And by that, this is like that originates in the brain. So there are many other, like what we call metastases from other cancers going to the brain. But glioblastoma is the number one that originates in the brain. And it basically evolves from some cells that we all have, that we all need. And something goes wrong with their inflammation and they start growing, which they shouldn't. And all of a sudden you have 2, 4, 8, 16, 32, and you have a tumor growing there. And so what sets brain tumors and a little bit apart, these gliomas, is that they're in the brain. And the brain is a very, I'm joking, is a very boring organ. Or who likes it to be boring and wants it all to be stable. So it's like hidden behind what we call the blood-brain barrier that makes sure that no poison, nothing that shouldn't be there is getting to the brain. But that makes it very difficult to treat as well. The brain has its own immune system. That means it's very difficult for the immune system to detect these cells that shouldn't be there and to destroy them. And the other challenges is there are a lot of parts of the brain that are really, really important and make us who we are. And so you cannot just take out things and have no consequences. So put all of that together, it makes it very challenging, but as well as rewarding. That's what we do.
We're joined by Dr. Tobias Walbert. He is from the neuro-oncology department at Henry Ford Health System. He is a brain tumor specialist, joining us talking about glioblastoma. And Dr. Walbert, you said that this is a highly common form of a brain tumor. It has its origins in some inflammation in the brain. Are there certain risk factors that are out there that make it so common, or are there risk factors that people should be aware of, or maybe trying to actively avoid if possible, that may put them at risk for developing a glioblastoma?
Yeah, that's a very good question, and that comes a lot of times because, of course, people want to make sure and want to know what might have caused it. But while there's some very rare forms of genetic underpinnings, and by that I mean hereditary forms, it is very, very rare. And we do not have a good understanding what is causing it. So I always tell people we don't know what if you did anything the wrong way or should have done the other way. Like for example, like a common question is about cell phone use. Yeah, but no, we do not have any good data about that. There are some other tumors called meningiomas where actually radiation is a risk factor, but not for the glioblastomas. So no, there is no specific testing, and to the relief of many of our patients, there is nothing that we are aware of that their children or other family members have to be on higher alert, and there is no specific gene we are testing for that could be inherited to other family members. So we don't know what is happening, but yeah, it's just like basically there are so-called like tumor suppressor genes. It's basically, these are genes that everyone has and needs that basically tell cells to stop growing, and something happens like in an evolutionary process that switches one off, and all of a sudden the cell starts growing, and there we go.
So, Dr. Walbert, you mentioned some of the risk factors that may lead to a glioblastoma. Are there certain demographics of our population, either by age, either by sex or gender, or by lifestyle, that are more at risk for developing these?
Again, like risk, we see two peaks. We see one in the younger, like in the 2030s, and that is certainly is a different genetic underpinning. And then the most patients are somewhere between 60 and 80. That is like the second peak. Yeah, and you see that like even on the bigger scale represented. There's like people that are, well, might be known to your viewers that had a glioblastoma, were like John McCain, Ted Kennedy, the former senator from Massachusetts, and then on the younger end, Beau Biden, President Biden's son. Yeah.
We're joined by Dr. Tobias Walbert. He is from the neuro-oncology department at Henry Ford Health System, and he is a brain tumor specialist. We previously had one of his patients on, Eric Goldstein, who saw his doctor in early 2020 because he had some vision problems, and then was diagnosed with glioblastoma, and that inspired him to create a YouTube one-man show called Here We Go. And so before we bring Eric in, because we do have him on the show as well, Dr. Walbert, when did you first meet Eric Goldstein?
Wow, this is a good question. It's probably a better one to ask Eric, because he will remember that much more. Like I do remember, and what is really interesting is like this all happened during COVID. So it actually took like quite a while, and until I met Eric in person. It's like just recently. Before that, like we had this virtual medicine, telemedicine relationship, and as he's quite tech savvy, and it worked out very well. And but the first encounter, we have to ask Eric.
And so Eric is with us on the show as well, Eric Goldstein, who has been previously with us, and his show, Here We Go. So Eric, tell us a little bit about that experience. We talked a little bit about it the last time you were on the show, but give us a little bit more insight on how you were going through this process and what it was like going through this process of treating your glioblastoma, of going through the diagnosis process and learning more about this brain tumor with the help of Dr. Walbert and others on your team of doctors. What was it like going through that during the pandemic and not being able to meet your doctors in a more traditional way, in an in-person way, and have that more typical interaction with them when you're going through something as traumatic as finding out you have a brain tumor?
Well, understand that the means of discovering the brain tumor was through an MRI, and that was in person.
Yeah,
you can't do that remotely. But then all the communications about the MRI findings and what we needed to do about it, that was all remote via phone and so forth, and using Henry Ford Health System's MyChart system. The surgery couldn't be done at Henry Ford because they had no capacity to do it because of COVID care. This was in April of 2020. But as they say, they knew a guy over in Grand Rapids that wasn't swamped with COVID yet, and arrangements were made to get me over there urgently. And the surgery was done there. And we had a very smooth transition of care back to Henry Ford when the surgery was done. And I remember being on the couch in the post-surgical recovery phase, and I got a phone call or a Zoom meeting. I forget exactly how it was set up, with Dr. Walbert. I'm a mess. You know, I've just come back from the hospital. My hair is in all these weird places from the surgical procedure. I'm literally a mess. And he is going, "Hello, Eric. You look so good today. How are you doing? I'm Dr. Walbert." And we had a lovely conversation. And he said, "Oh no, I'm used to seeing you and people like you. You're fine." Dr. Walbert has instilled such great confidence from the very beginning. I did not feel deprived of care because we were doing it remotely. He's an excellent communicator, answered all the questions, was very patient with us, because you might imagine we had lots of questions, and he absorbed them all over time and answered them the best as he could, and was very helpful to us. So I would say I liked not having to spend all the time driving and parking and trying to get. That was at a time when I couldn't really even walk. I could only shuffle, and for short distances. So I actually think we had a better experience because we could do it remotely.
And of course, Eric, we've talked previously about how your one-man show on YouTube, Here We Go, which premiered earlier this month. It premiered on October 2nd. It's still, of course, available on YouTube. For those of you that are interested, just search Eric Goldstein, Here We Go, and you'll be able to see his show on YouTube. And so, it's been almost 2 weeks now. It's been just a little under 2 weeks since that has been released. Have you gotten any response so far on the program from people that have viewed it, from those that have maybe shared it themselves? Any response so far 2 weeks in after releasing it?
I've been contacted by other glioblastoma families and advised that that show gave them the vocabulary that they lacked, that they wanted to talk about things, complicated and difficult things, but they couldn't find ways to talk about it. And this show gave them the tools to do that. I've also been contacted by people not afflicted by glioblastoma and been told that our story of love and hope and looking the situation in the eye has been very helpful for them as they struggle with the burdens and complications that they have in their lives. It's been very gratifying to see that we've been able to offer some support and help to others.
And of course, Eric Goldstein's show, Here We Go, is available on YouTube. It premiered on October 2nd. It is still available, of course, on YouTube by searching Eric Goldstein, Here We Go, and you'll be able to see that entire show that has been providing a whole lot of optimism to glioblastoma families, as well as Eric just said, to those that aren't afflicted with glioblastoma or are dealing with someone in their life, a loved one, a family member, a friend, or anybody else that has glioblastoma. It's just been something inspirational about it that has changed their perspective on life. So there's a lot of optimism that's come from that. So Eric, thank you very much. Going back to Dr. Walbert, Dr. Tobias Walbert from the Neuro-Oncology Department at Henry Ford Health System. He's a brain tumor specialist. What are the latest advancements in the treatment of brain tumors such as glioblastoma, as opposed to several years ago or decades ago, that maybe hopefully can provide more optimism or more quality of life at the very least to those patients who do experience a glioblastoma?
Yeah, one of the big things we do at Henry Ford is a lot of research. Like, we're trying to offer every patient the opportunity to participate in a clinical trial or in a study, helping to further discover what's next and what we can do. I'm very optimistic about the future. Like, the recent years has been really more focused on discovering the underpinnings, the molecular mechanisms, why do some tumors grow and come back while others do not. And based on that, we are developing new trials that are really targeting these molecular mechanisms. So we realize that that there is no one fix for everyone. And so that's what we do with a lot of these new clinical trials. Other things, what we have been working on, and that came more into focus, is a new device. It's called tumor treating fields. That is actually something that Eric is wearing. It's like basically applies an electric field to where the brain tumor was that inhibits the cells from growing. It's like some big band-aids on it. And that has been shown to meaningfully increase survival. And while we are unfortunately still short of the silver bullet, there have been many advances as well in surgery, and that's the first big step. And so at Henry Ford, we have had the first intraoperative MRIs years ago, and then we established something called tumor paint. It's like a special dye or juice that patients drink before the surgery that makes the tumor more visible under the special microscope for the surgeons. And now a new phase that we are working on is like looking at how like a special radiation tile can be implanted when patients undergo surgery when a tumor is coming back. So we work on all different kinds of levels. One of my personal quests is about how we can improve care for patients in the palliative or end-of-life setting. How can we improve communications with families? How can we enable families and patients to have conversations that we all should be having about what do we want in life, what do we do not want? And that, I think, was very eye-opening to see Eric's piece. It's because he's so point on, and to see what goes on in the mind of a patient. Yeah.
We're joined by we're joined by Dr. Tobias Walbert. He is a brain tumor specialist in the neuro-oncology department at Henry Ford Health System, as well as Eric Goldstein, who is a glioblastoma patient and is the producer of Here We Go, a one-man show about his experiences and the life lessons he's learned through his battle with glioblastoma. Dr. Walbert, Eric, thank you very much for being with us today.
My pleasure.
Appreciate it. And Dr. Walbert, just one last question before we say goodbye today. For those out there who are watching this who may be curious or want to be extra cautious because this is such a common form of a brain tumor, what should people be aware of as maybe some symptoms that they could be potentially afflicted with this form of a brain tumor? Or what can they do to assure themselves that they are properly protecting themselves from this danger, or at least getting out in front of it as soon as possible?
Yeah, of course. So the brain, I always say, it's like real estate. It's location, location, location. So it really depends on what part of your brain is afflicted, and that can cause. Many patients present first with a seizure. So yeah, if you have a seizure, you do end up in the emergency room, and that is quite common. Or if there is a weakness on one side that is not going away, first thought, of course, is always stroke. And so you always want to be in the emergency room and call 911 as soon as possible when something like that happened, a sudden weakness, sudden speech, and then go from there. Sometimes, but not as often, headaches can be a sign, but that, again, it's not as common as people might think. I always tell my patients, remember, the brain does not feel pain, so there are no pain receptors in the brain itself. They are on the coverings of the brain. So it really depends. Any of these symptoms, you work with your primary care doctor, and you come in, and I know there has been a lot of reluctance, of course, like with the most recent COVID developments. But for example, at Henry Ford, we were one of the first health systems where everybody has to be vaccinated. So we create a safe environment for everyone to come in and to get the treatment that they need.
Well, Dr. Walbert, appreciate it, and same to you, Eric. Appreciate both of your time today to reopen this conversation we've had previously with Eric, but also inform the public about this common form of a brain tumor, what risk factors are out there for people to potentially develop it, some of the experiences in learning about this brain tumor and treating this brain tumor, as well as some optimism as well with great research that's being done in many health systems, including Henry Ford, right here in our local area. Appreciate your time.
Thank you.